Kristen with the Cancer Support Community. Welcome to our webinar, Frankly Speaking About Cancer, Managing Immunotherapy Side Effects, hosted by the Cancer Support Community. If you need technical assistance during the webinar, please dial 1-866-229-3239, option 1. If you'd like to listen to today's presentation via telephone, please dial in using the conference line code you see on the screen. Today's call is being recorded and will be available on our website at www.cancersupportcommunity.org. The format of today's webinar will be as follows. The panelists will begin the discussion first, and then we will open the discussion up to the audience during the question and answer session. Thank you to those who submitted questions prior to the webinar as part of the registration form. Many of the questions that were asked will be addressed during the presentation. But if you do have additional questions, feel free to type it into the Q&A box on the right of your screen. You may submit a question this way at any time during the event. At the end of this webinar, you will be automatically redirected to the post-webinar survey. Please take a few minutes to complete this survey, as your input is of great value to us. I would now like to introduce the Cancer Support Community, which is the largest professionally led nonprofit network of cancer support worldwide. CSC is dedicated to ensuring that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We offer the highest quality social and emotional support through our affiliate network, as well as online or over the phone. On this screen, you'll see some of the resources we provide at the Cancer Support Community. The first one there is the Cancer Support Helpline, which is staffed by licensed professional counselors who are available to assist you Monday through Friday, 9 a.m. to 9 p.m. Eastern Time. We also have our Open to Options program, which is a research-proven program that can help you prepare a list of questions to share with your doctor. We also have our Frankly Speaking About Cancer program, which is CSC's landmark education series, which provides trusted information on a variety of topics important to people affected by cancer. We have a wide variety of information available through print, on the web, online, and in person. I would also like to introduce our Cancer Experience Registry, which is a program of CSC and a place that you can go to make sense of your cancer experience. You can tell your unique story, connect with others, advocate as active members of a community, and learn from experts. For more information or to enroll, visit www.cancerexperienceregistry.org. I would also like to take a moment to talk about our grassroots movement, which helps ensure that people touched by cancer have access to quality, comprehensive cancer care that includes social and emotional support. Again, if you would like to learn more about this program or to sign up, visit our main website at www.cancersupportcommunity.org. I would now like to introduce tonight's panelists, Kristen Linney and Ashley Holler. Kristen Linney is a registered nurse at Duke University Medical Center. Kristen started working as a nurse at Duke in 1998. The last 16 years of that time has been in clinical research. Kristen joined the melanoma program at Duke in 2011 as the Assistant Research Practice Manager for clinical trials. Kristen oversees the daily operations of all melanoma clinical research at Duke. The main focus of these trials are patients with high-risk, advanced, or unresectable melanomas. Ashley Holler has worked as a nurse practitioner at the Duke Cancer Center for the past 3 years. Prior to this, she worked for 5 years as a registered nurse in inpatient oncology. She graduated from the Duke University Nurse Practitioner Program in 2013. In her current role, she works with advanced melanoma patients as they undergo treatment. Many of her patients are receiving immunotherapy. Therefore, her primary role has been to monitor these patients in the clinic setting and follow them closely after treatments to help manage side effects and symptoms. Kristen and then Ashley will give you some basics about what immunotherapy is and what side effects you should be watching for before I start asking them a series of questions. Kristen?
Yes. Hi, this is Kristen, and thank you for having me on tonight's call. So the first thing we're going to talk about is what is immunotherapy. And first we'll talk about immuno-oncology, which is the field of cancer research that we work to understand the immune system and how it interacts with different kinds of cancer so that we can hopefully find ways of using your body's own immune system to treat and possibly prevent cancer. So immunotherapy is a type of treatment that uses the immune system to treat cancers as well as other diseases. And they can work in a couple of different ways. They can stimulate the immune system to work harder or smarter to attack the cancer cells, or it can also give the immune system components such as man-made proteins to help stimulate the immune system. There are a few types of immunotherapy. There are monoclonal antibodies, which are basically man-made versions of immune system proteins. And there are immune checkpoint inhibitors, which would be a drug like ipilimumab, which is anti-CTLA-4. And then there are cancer vaccines. All of these fall under the heading of immunotherapy. So the next slide, we're going to just have a segue into the side effects of immunotherapy because they really can be quite different from the side effects of traditional chemotherapies. And a lot of times people think that immunotherapy, since it's using your body's own immune system, means that maybe the side effects are lesser or less common. But there are still side effects. They can be managed and, range in severity, but there are still side effects that need to be monitored. And that's where Ashley's going to step in.
Hi, I'm Ashley Haller. Thanks also for having me. So just sort of a brief overview of some of the side effects with immunotherapy, and we'll get into a lot of this sort of later in the presentation as well. But some of the more common side effects that we can see are flu-like symptoms, fatigue, different rashes, fever, drops in blood pressure, which is called hypotension, and some of the less common side effects, but certainly still side effects that we can see are colitis, which is basically patients having diarrhea from inflammation in their GI tract, as well as other GI problems such as nausea and vomiting, also thyroid problems and lung problems as well. And then just to go to the next slide here, so just some actions that you can take while you're getting immunotherapy is learning a lot about the treatments that you're going to get and the potential side effects before you even begin therapy so that you'll know what to expect. And then also if you're having a side effect, you know that this is a side effect from your treatment and can take the appropriate actions. Also knowing that everyone is going to react differently to treatment. Some patients sail through with no side effects. Others have lots of side effects, and it's sort of anywhere in between as well. So it just helps you be more prepared. And it's also very important to keep your doctor and your nurse aware of any side effects that you are experiencing, even if they don't seem very significant to you, your doctor and nurse will want to know and can help you manage if management is needed. And then, of course, some serious symptoms will require treatment, while sort of minor problems or minor side effects can be managed with interventions such as just lifestyle changes, possibly diet and exercise and things like that. So I guess we'll get into the questions.
Great. So one question that people had was, what should patients know about side effects associated with immunotherapy? Kristen, do you want to answer that first?
Sure. I think my biggest thing would be that patients need to understand the importance of reporting the side effects, because a lot of the side effects that are experienced with immunotherapy can start at one degree and can progress to more severe if gone kind of untreated or unnoticed, whereas if we step in on the earlier end, a lot of times it's very simple to get the side effects under control. So I think sometimes the side effects with immunotherapy can look like maybe you went out to dinner and you think you had a bad meal and you kind of slough it off instead of reporting that, and maybe it is kind of the beginnings of an immune-mediated colitis, or maybe you're getting the beginnings of a rash. So I think having patients know how important it is to report the side effects is really important.
Ashley, do you have anything to add?
Yeah, absolutely. I think also knowing that not all immunotherapy drugs are the same. There's lots of different immunotherapy regimens out there that vary for the different cancer types, and some involve just one medication, and some can involve a combination of medications. And so while the side effects are all similar, they often vary, based on the actual medication you're getting. So sometimes if you have a friend getting one medication, one immunotherapy for a cancer, and you're getting something else, just knowing that the side effects won't necessarily be the same for you as they are for another person. And just remembering sort of what Kristen said also, that while a lot of these medications are pretty well tolerated, there's certainly the potential for minor side effects and more significant ones. So just reporting everything, even if you don't think it seems significant, just letting your provider know, and then having your provider sort of help you decide if it's significant or not instead of putting that on yourself, I think is really important. And then also just, I think this was touched on sort of on one of the beginning slides, but just remembering that immunotherapy is very different from traditional chemotherapy, which has been used a lot in the past to treat cancer. And so the side effects are very different because of the way the medication works in the body. So that's why, again, it's really important to report the side effects because they're treated a lot differently. Diarrhea from immunotherapy is treated a lot differently than diarrhea from chemotherapy. And so it's just really important to keep your providers aware of any side effects.
Great. I'm having a little technical difficulty here trying to make the slides move, but there we go. We talked about some of the more common side effects of immunotherapy. Are there other side effects that patients should be aware of? Ashley, do you want to go first this time?
Sure. Yes, there's definitely other side effects. I mean, certainly the most common side effects that we see, especially in my clinic, are fatigue. Rashes are pretty common. And then, of course, the diarrhea. But some of the other side effects that don't happen as often but certainly can still happen, we can see inflammation and irritation of both the liver and kidneys. And so often your doctor will be checking blood work on you each time you're coming in for a treatment or every other treatment, depending on their protocols, just to keep a close eye on the kidneys and livers. And as well, it can affect the pituitary gland, which sort of sits in the base of the brain, and that helps us make our natural steroids in our body. And so when that gets shut down, patients can feel pretty sick from that. And it doesn't happen as often, but still, one of the other side effects to know about and to report symptoms for.
Kristen, do you have anything you want to add?
Sure. So I think those were exactly as I would say. And then I think another one that we don't see quite as often, and sometimes patients get a little bit concerned, but sometimes it can actually be a good indication is something called vitiligo, which is depigmentation of the skin, and that can be a side effect with some of these immunotherapies. And it can also happen with the hair. So hair can turn white, like eyebrows and eyelashes, and it can be a little bit off-putting if patients aren't aware that that's something that might happen, but it does sometimes happen in rare instances.
Good information. So, Kristen, what is the role of the nurse in immunotherapy treatment?
So I view my role, and my role is a little bit narrowed down to kind of the clinical trial lens, but I view our role as clinical trial nurses as being advocates for the patients, making sure that the patients understand how important it is to call with any kind of side effect, and as Ashley pointed out, really kind of taking that burden of deciding if it's something that's serious or worth reporting, taking that burden off of the patient and just having the patients report everything to us, and then we can kind of help decide if it's something where the patient needs to come in or that kind of thing. So I think the relationship with the patient and the nurse, so that the patient feels comfortable reporting the side effects and kind of reporting how they're feeling throughout their therapy, so that we can keep them on therapy as long as it is benefiting them.
Ashley?
Yeah, so I know in our clinic we have a clinic nurse who comes in and does a lot of education with the patients ahead of treatment. So on the day that they come in for their first cycle, they sit down with our clinic nurse and do a lot of education and make sure that they have the appropriate numbers for calling and sort of going over the most common side effects and things to expect. And then we oftentimes, again, I know here at Duke we have a program set up where either myself or the clinic nurses will give patients a call after treatment just to check in and see how they're doing and make sure they're not having any side effects, and then just helping to manage the side effects, helping manage diarrhea and rashes and things like that, and letting me know if they need a prescription for anything. But a lot of education, I think that's really important, is education before getting started with immunotherapy. So again, you know what to expect, you know what to report, and then for the patients who don't necessarily always report things, we check in with patients and just see how they're doing and double check and make sure they're not having fatigue or diarrhea or rashes or in between cycles as well.
Thank you. So, Ashley, do side effects mean that the immunotherapy is working?
This is a great question. So not necessarily. I've seen a little bit of everything in my clinic. I've seen patients who have done great with treatment and had no side effects and have had a really nice response to immunotherapy. I've had patients who have had a lot of side effects and have not had a great response to immunotherapy. So I've seen sort of a mixed bag in my clinic. So there's not a direct correlation between side effects and the immunotherapy working. But I certainly have seen a little bit of everything. I've seen people have side effects and do well, with the immunotherapy in terms of a response too. So I've seen a little bit of everything. I don't know if Kristen has anything to add on that one.
Yeah, I think, it's always hard to tell, and patients ask, if they are having side effects, does that mean that the therapy is working really well? And I would say it is a mixed bag. We have some patients who have tons of side effects and do really, really well, and some who have a lot of side effects and the therapy, doesn't work so well. So it's hard to say really who is going to respond well, based on side effect profile.
So, Kristen, do multiple side effects usually present at the same time?
So they can. Again, it varies. Like Ashley was saying earlier, there are some patients that just sail through immunotherapy and don't seem to have any side effects, and then there's some patients that seem to kind of get every side effect that we've seen. A lot of times, we'll see kind of the rash and the fatigue come together. That just kind of depends. And then, of course, if there is going to be a side effect like an endocrinopathy, like adrenal insufficiency or that kind of thing, that will be bundled with a few different symptoms within that side effect. So we can see them crop up together, or it can be, a patient just has one side effect the whole time, or maybe they have one side effect and then we kind of get that one under control and they move on to another side effect.
Ashley, do you have anything to add to that?
Yeah, no, I definitely agree with Kristen. I think it can happen in all ways. I've certainly seen patients present with multiple side effects, and as she pointed out, the endocrinopathies, so the thyroid, the adrenal insufficiency. Sometimes those things can happen at the same time, as well as symptoms of hypothyroidism or an adrenal insufficiency. They might have multiple symptoms that sort of fall under that one heading. But yes, I've seen patients get over one side effect and then develop another one, or multiple things happening at the same time when they come into clinic and we see them. So I've definitely seen a little bit of everything with that.
Okay. What else should doctors and patients be aware of before starting immunotherapy treatment?
Do you want me to go first?
Please.
Sure, yeah. So making sure, patients really need to talk with their doctor about their medical history up front, so that they know if you have any underlying autoimmune diseases or disorders, like, for example, rheumatoid arthritis, because that will certainly affect the plan for treatment. Not saying that you can't do immunotherapy with different autoimmune disorders, but you often sort of need to manage it differently. And so just making sure that your provider is aware of your full medical history. And then for patients, before getting started with immunotherapy, just having all the contact information for your provider, how to get in touch with people, during business hours, after hours, on the weekend, and making sure you take all that information if you're traveling or going on vacation, so you have all the information to get in touch with your providers sort of at all times, I think is really important before you even get started with immunotherapy.
Great information. Kristen, did you want to add anything to that?
I think I would agree completely. And then I think also just really understanding the schedule is important for patients, so that they understand that if they're going to get treatment every 2 weeks or every 3 weeks or whatever that might be, so that everyone is really clear at the onset of kind of what it's going to take to go on to this therapy, and then having a frank discussion with your doctor before you start therapy about what happens should you get a side effect, and need to come in, and what's that going to look like in terms of time commitment and those things.
So why is it important for a patient to report all their side effects, even if they are low grade, Kristen?
Yeah, so I touched on this a little bit earlier, and I think, everybody, nurses, providers, everybody, the patients, we want to stay on the treatment for as long as it's working and providing benefit. And I think that that's a big reason to report side effects as early as possible, even when they're very low grade, because we can step in and do some things to help and to get the toxicities under control. And maybe it means taking a break in treatment, skipping a dose, but that will mean starting back on therapy in all likelihood and being able to continue, as opposed to if side effects are not reported until they're kind of at that higher grade of seriousness, then the ship may have sailed and we can't continue the therapy, or, we have to do a lot more to get the side effects under control. So I think it's always really, really important to report them when they're low grade, and that it actually helps to stay on the therapy longer, rather than, I think some patients feel that if they report the side effects that they're going to get taken off of their therapy. And I find that to actually be the opposite. So I'm a big advocate of reporting as many side effects as you think you're having.
Interesting point. Ashley, do you have anything else that patients should know about this?
Yeah, absolutely. So I think even reporting low-grade side effects, because side effects can escalate quickly. You could have a rash on just your arms one day, and the next day it could be, almost a full body rash. Same thing with diarrhea. The first day you could be just having maybe 1 or 2 episodes of loose stools, and, in 3 or 4 days it could be up to 8 to 10 episodes of loose stools a day. So it's just really important, because sometimes the doctors will want to intervene early, because usually then, if the side effects are going to require, steroids by mouth or something like that, you can usually do a quick taper, or a quicker taper, I should say, over just a few weeks, as opposed to a prolonged steroid taper, especially if side effects have been persisting and sort of unreported. And then, you're kind of playing catch up and trying to get these under control, and it can take longer to respond to some of the topical steroids or oral steroids and things like that. So even low-grade side effects are real important to report. In addition, things like, some fatigue, some patients don't think a whole lot of it, and then, we do the workup, and they end up having things like an adrenal insufficiency or hypophysitis, which is, with the pituitary gland, even if they weren't really thinking that the fatigue was that significant at first. So still really important to report things like that.
Thank you. So what do we know about the long-term side effects of immunotherapy, Ashley?
Yeah, so there's certainly some side effects from immunotherapy that can be permanent and require lifelong treatment. One example is an adrenal insufficiency. So patients who are diagnosed with that will likely be on lifelong treatment with steroids. And usually an endocrinologist or the oncologist can get someone on what's called a physiologic dose of steroids. So that's a dose of steroids equivalent to what we naturally make in our bodies, but then patients will need to be on that daily and lifelong. And that's the same thing with the thyroid. Patients who end up having hypothyroidism from treatment will likely be on lifelong levothyroxine or Synthroid to help replace the thyroid hormone that they're no longer naturally producing. So we do know there are some side effects from the immunotherapy that require lifelong treatment. Other side effects like the colitis and rash are typically things that we can treat and then will resolve, and are not, after treatment's over, are not necessarily likely to be a lifelong issue for folks.
Thank you. You actually just answered one of the questions that had come up in our question and answer.
Excellent.
Kristen, can you tell us anything more about long-term side effects of immunotherapy?
Yeah, so I think all of those are true. The only thing I would say is I think we're still learning some of the long-term side effects, and we don't know everything that may present itself down the line. And then the only other one that I'm thinking of a patient in particular would be diabetes, which again would be lifelong insulin therapy. So.
Well, and that's a good point because immunotherapy hasn't been around that long. That's a very good point, that we don't know everything. So at this time, we would now like to open the discussion up to the audience. We got a number of questions submitted when people registered and also several during the presentation. And audience members, if you have any additional questions, please feel free to type them into the question and answer box to the right of your screen, and we'll try to get to as many of them as we can before the webinar ends at 7:30 Eastern Time. So one question that we got was, what cancers are currently responding to immunotherapy? Kristen, do you want to?
Sure. Right. So melanoma is responding and was one of the first diseases that that some of these immunotherapies were approved in. And then also non-small cell lung cancer is another one. It's actually, there have been some responses in leukemias and lymphomas, and even some head and neck and some of the bladder and stomach cancers. So that it really is showing some good response in a number of different cancers.
Ashley, anything to add to that list?
Yeah, absolutely. I will say, so immunotherapy is sort of the latest and greatest in cancer research right now, and it's being tested in all types of cancer. One of the other cancers it's very rare, but I actually work with in my clinics is a Merkel cell carcinoma, which is also being found to respond to immunotherapy as well. And so we're treating some people with Merkel cell. Again, it's a rare skin cancer. Folks haven't heard of that before. Similar to melanoma in the sense that it's rare, but and then sort of the other ones that Kristen had listed. It's also being used and obviously tested in lots of other types of cancers as well.
I know we had a panelist last week who said that he couldn't think of a cancer that they weren't trying to test immunotherapy drugs in, at least in clinical trials. So it definitely is a hot topic right now and a big research focus. The next question is about, and a series of questions actually, is about using immunotherapy in combination. One of the questions about using immunotherapy in combination is, if you have side effects, if you're using immunotherapy in combination with chemotherapy, how can you tell which is causing the side effects? So if you have diarrhea while on a combination of chemotherapy and immunotherapy, how do you know which is causing it?
So I can, yeah, sure. So I can speak to that. So it's a great question, and it is hard to tell. I will say sometimes in these folks we might try just a short course of things like Imodium or Lamodal to see if the diarrhea, if they're having diarrhea or colitis, to see if it responds, because often diarrhea induced from chemotherapy may respond to these agents, whereas diarrhea from immunotherapies wouldn't necessarily respond to things like Lamodal and Imodium, and so we'll often maybe try those first with a very low threshold to switch over to steroids to also, to give that a try and see if it helps. Sometimes what you ultimately have to do is a colonoscopy to see if there's actually any any inflammation within the colon, and sometimes that's the most diagnostic way to tell. The other thing is to do some stool cultures to make sure that there's not an infectious source for the diarrhea as well. But it is tough sometimes to differentiate between the different side effects from chemotherapy and immunotherapy, and so sometimes it's trial and error of trying different agents to see what it responds to, and that sort of helps narrow it down as to what's causing it.
Kristen, do you have anything to add?
Yeah, I would say it can be a lot of trial and error, but thinking about what the root cause is. So with immunotherapy, most of the side effects are all related to, inflammation or some kind of immune reaction. And so, like Ashley was saying, with the colonoscopy, and we can tell that there's inflammation in the colon, and that's because of the immunotherapy. And there are other tests that we can do for other side effects that will show us some of that inflammatory response that the body is exhibiting.
Thank you. So another question that has to do with being on combination drugs, do you find that there are more side effects when a patient is on either a combination of immunotherapy drugs or a combination of immunotherapy and another kind of therapy? Kristen, do you want to take that first?
Sure. So again, I think it really is analogous to side effects in general on immunotherapy. We have some patients who sail through it and have no side effects, and others that seem to have lots of side effects. And the same kind of holds true for combination therapy. We generally think that there, can be more side effects with combination therapy. That said, you're going to have patients who are not going to have side effects, to either one. So we do see some patients who, just really don't exhibit any side effects even on combination therapy.
Ashley?
Yeah, so certainly agree with Kristen. I think it's very sort of patient dependent. It's also actually sort of dosing dependent. So, we have some combination therapies that are better tolerated than a high dose of a monotherapy. So using one drug at a time but at a higher dose sometimes can produce even more side effects than a combination of therapies. So it's really dependent on the agents that you're using, also dependent on the patient, and actually comes down also dependent, on the dose as well of the drugs that we're using. So, a lot of factors go into play there.
Thanks. And as long as we're talking about side effects, do you actually have any guidelines on how to manage the fatigue that comes as a side effect, and how do you decide what you should push through and when you shouldn't be pushing through your fatigue?
Yeah, it's a great question. So I usually sort of characterize my fatigue with my patients as either debilitating or not debilitating, and the way I think of that is, if patients are in bed, the majority of the day, if they're no longer able to get chores done around the house or do errands, or if patients are still working, if they're no longer able to work, that's fatigue that I'm concerned about, and I would likely do an additional workup with some blood work and check both the thyroid and the pituitary with some blood work to make sure there's not a treatable cause of the fatigue. But some mild fatigue, often we have to just kind of push through. And actually, it seems counterintuitive, but I usually recommend, a little bit of light exercise and trying not to be in bed all day long, because that can actually worsen fatigue. So a little bit of light exercise and a healthy diet can sometimes help with the fatigue. But again, if it's very significant, there should be an additional workup to make sure that we're not looking at an endocrinopathy or something that we could treat and help patients feel a little bit better from the fatigue. So it's a little bit everything. But yeah, again, mild fatigue, often we can just treat with some lifestyle modifications to see if that sort of helps them get through it and get through the day.
Kristen?
Yeah, so I think, we want patients to continue to do as much as they can and that they feel comfortable doing while on therapy. And, so if they are having some of that mild fatigue, still continuing with their daily activities is always a good thing, and can help with other, kind of exacerbating other side effects such as, depression or anxiety. If patients are getting out, that's less likely. But the patients who, can no longer work or are in bed all day long, then those do need to be managed differently.
Thank you. So is there a difference in how immunotherapy treatment impacts your body when you have metastatic disease versus when you have local or regional disease? Kristen, do you want to try answering this question first?
Sure. So we have a number of kind of regional clinical trials for patients, and then we have a number of metastatic clinical trials. And again, I kind of go back to the same answer that it really is patient dependent, and as Ashley was mentioning, dose dependent. So some trials have a higher dose in, say, the adjuvant setting, or a lower dose in the adjuvant setting, or vice versa, and some patients do really, really well with the side effect profile, and some patients seem to have a lot of side effects. So I do think it's kind of patient and dose dependent.
And Ashley?
Yeah, another thing to keep in mind, too, so often patients with metastatic disease, depending on how sort of widespread the disease is and how many organs it's affecting, may already sort of be a little bit more symptomatic from the cancer, and it may sometimes can make it a little bit more challenging to deal with the immunotherapy and the side effects. So in that sense, it could affect a patient a little bit differently than someone who just has local disease or, disease in the lymph nodes, as opposed to people who have disease in a lot of other organs within the body, because they can just be feeling already, not great from the cancer, and that just makes it a little bit more challenging to deal with some of the side effects.
Okay. There have been two questions now about muscle and bone pain. Two different patients who are on Imbruvica, 3 pills a day, say that they have pain almost every day. One asked what can they take for muscle and bone pain, and the other asked if, because they have pain every day, should they be looking at cutting back their dose?
That's certainly a question for their provider for sure, but muscle and bone pain, depending on sort of the cause, if it's an inflammation in the muscle or bone, it may be something that needs to be treated with steroids. Often, though, muscle and bone pain can be treated with things like ibuprofen and Tylenol to start with, but often you want to do some additional blood work to check and see if there's actual inflammation within the muscles, and rule that out before you just try treating with ibuprofen. But you can also, sometimes patients will need steroids by mouth in case there is some actual inflammation there to help decrease that inflammation and help with the pain. As for a dose reduction, I would probably sort of defer to their provider, because I'm not as familiar with that medication in the field that I work in.
Kristen, do you have anything to add?
I don't think so. That, really would depend on the provider and that particular drug, which, again, we don't see as much in this particular disease, and also where their disease is, and if there, is any kind of disease that is exacerbating that bone pain.
Okay, and to follow up on bone pain, another participant wrote about pain in their knees, hands, bottoms of their feet, wrists, and elbows, especially after working or walking a lot. Is this something that could get better over time?
So it could. Again, it all depends on kind of what the cause is and if it's a side effect of the drug, how it's being treated and managed. And we do see a lot of times patients who have these kind of severe arthralgias, it to improve with time and on steroid therapy.
Ashley?
Yeah, certainly would agree with that. Pain in sort of the joints, the arthralgias, I mean, we've certainly seen inflammatory arthritises, and so sort of finding the root cause, sometimes there's some additional blood work that needs to be done to help determine, again, there's a lot of sort of inflammatory markers within the blood, and that helps determine if it's a true side effect from the immune therapy. And it should, most of these things, if you report them and are able to treat them up front before they sort of get too debilitating, then you can certainly, often will need to be treated with some steroids, but they should get better, over time and after some steroid management. But again, you do want, a provider would probably want to do some additional workup just to see exactly what you're dealing with. There's some different blood work that you can do that checks for inflammation within that checks for inflammation. It can help sort of guide management and figure out the root cause of the pain.
Thank you. So to ask kind of a bigger picture question right now, do you have opinions on treatments such as diet, exercise, acupuncture, massage, chiropractic, and how they can boost the immune system? One patient even wondered, why aren't they part of an immunotherapy treatment regimen?
So I certainly encourage patients to incorporate these modalities into their treatment regimen. I always encourage patients to have a healthy lifestyle through diet and exercise as tolerated. Here at Duke, we have an integrative medicine program that a lot of my patients utilize that does incorporate massage and acupuncture and things like that into their treatment regimen. It's not necessarily something that that we do in our clinic, but we do have sort of a program that patients can sort of work in conjunction with their treatment. I will say you just have to make sure and check with your provider first to make sure there's nothing that's contraindicated. So like chiropractor and massages might be contraindicated for patients who have, say, cancer in their spine and other places because those treatment modalities might actually cause more pain. But I certainly, encourage a healthy lifestyle. And it'd be important to check at your facility where you're getting treatment if they do have any integrative programs where you could sort of do some alternative therapies in conjunction with the treatment that you're getting for the cancer as well.
Kristen?
Yeah, so just to piggyback onto that, I think always, a healthy lifestyle is never a bad idea and can definitely help boost the immune system. Where we do caution patients is kind of in the supplement range and, with dietary supplements, just simply because we don't always know exactly what is in those supplements, and it could be something that maybe when combined with the immunotherapy maybe has a greater effect on the liver, or those kinds of things, and then kind of can taint the results from blood tests that we do to where we think that maybe it's the immunotherapy causing it. So I think it's always good to, eat a healthy diet, exercise as tolerated, but kind of those dietary supplements, try to avoid as long as you're having a healthy diet.
Great. One question that we just got, Kristen, is can immunotherapy affect hemoglobin counts?
So it can. The other thing that can affect the hemoglobin is the actual disease. And so we check that every time a patient comes in for treatment to make sure that those hemoglobin levels are staying at a safe level. We don't typically see the hemoglobin drop like it sometimes can with traditional chemotherapy, although, not always. But sometimes it can be an indicator of something else going on that we need to be aware of. So we do keep a close eye on that hemoglobin.
Thanks. Ashley?
Certainly agree with Kristen on that. We keep a close eye on it. My patients who come in for treatment have a CBC checked every time they come in, which the hemoglobin is part of that. And again, just checking for the cause of the anemia, because often we don't necessarily see it with immunotherapy, but the cancer itself can certainly cause it. Specifically, people who have cancer in the GI tract might be sort of slowly losing blood through the GI tract, and that can result in an iron deficiency anemia. So sometimes that you may need to treat with iron supplements and things like that. So just sort of finding out the cause of the anemia. But we do keep a close eye on it from both a treatment standpoint and a cancer standpoint.
Thank you. So Ashley, we've talked about perhaps having to go on long-term steroid use as a result of some of the long-term side effects. What are the most extreme downsides of long-term steroid use, and how long can long-term be?
Great question. So I typically, if I have to treat patients for a side effect, if I have to treat them with steroids, my goal is to have patients off the steroids within a month. It's not always possible, but that's sort of our goal, is to do a taper, or a 4-week taper. For some things, it can be quicker. If patients are just having itchiness, often I can do a quick, like a pred pack, so basically like a week of steroids and done. But things like colitis, often we have to treat with a little longer course of steroids, and so some of my patients can end up being on the steroids for several weeks. I usually consider sort of long-term steroids anything over like 4 to 6 weeks. At that point, I would have hoped to have gotten them off the steroids. And so some long-term complications of being on the steroids, or I should say some complications of being on steroids for a long time, patients can get a lot of weakness in their extremities. It can cause insomnia, so keeping you up at night. I usually counsel patients not to take it late in the day if they can help it. Also, the weakness kind of goes along with atrophy of the muscles as well. Those are some of the things. We also look out for irritation of the stomach, because prednisone, similar to like ibuprofen, can irritate the stomach, and so we'll often have patients take things like Prilosec or Protonix while they're on steroids, as well as I had something else in my head and now I'm forgetting. Things like opportunistic infections. So people who are on high-dose steroids, they're more immunocompromised, and so there's the risk for opportunistic infections to sort of take over because the immune system is sort of low. And so we often will put people on prophylactic antibiotics to help prevent pneumonia and things like that while patients are on steroids.
Kristen?
Yeah, that's exactly, that last one was exactly what I was thinking, and true. And then I would just say, when we do have to put patients on kind of that lifelong physiologic dose of the steroids, that's not where we see, all of these side effects from steroid use. So patients who do end up having to be on kind of lifelong steroids, I wouldn't want them to be overly concerned about, kind of the pneumonias and that kind of thing related to the steroids.
And you just answered a follow-up question about that when it's a long-term use of a replacement dose. So thank you.
Oh, good.
And I think this is kind of related. If a patient starts to see an autoimmune disorder such as hypophysitis from the drugs, and eventually goes off treatment, do any of them return to their prior level of function?
So once we, if you have like a hypophysitis or that kind of thing, once we have kind of knocked that out, then they'll need to be on a physiological dose of the steroids to kind of replace what's not being made. But after that kind of initial period of they can experience the extreme fatigue and headaches and all of that. After we kind of get that under control and get on a stable long-term dose, then those symptoms really do greatly improve, and they go back to feeling much more like themselves.
Ashley, anything to add to that?
Yeah, no, just exactly what she was saying. I think once you've stabilized, and specifically with hypophysitis, we work with endocrinology a lot in managing that. But once you've finally found what I call the sweet spot, the right dose for a patient that sort of matches what they were naturally making in their body prior to the adrenal insufficiency or the hypophysitis, often, it takes time, but often my patients do return to their baseline and their normal, because now they have the natural, instead of making the natural steroids, we're replacing it, but they're at basically the same dose that they were making, prior to the event. And then just keeping in mind with the hypophysitis, you need to keep in mind stress dosing. So, when we get sick or are going to surgery or things like that, we would naturally be making more steroids in our body. So again, these patients are not making, the natural steroid production, and so they would need stress dosing of steroids. So often a little extra steroids to help manage with illnesses and surgery and things like that, because you're no longer naturally making the steroids. So keeping that in mind as well for sort of lifelong management.
Well, our presenters are really in tune with our attendees, because the follow-up question was about extra doses in times of stress. So thank you, Ashley, for that. You answered the question before it was even asked. So we're getting towards our end of time, so we have time for one more question. And the last question that we have is, do you encounter any other patients with itching that feels like their bones itch? Does that get any better?
I will say it sounds like a very deep itching. I don't know that I've necessarily had a patient describe their itching like that. I will say cutaneous or skin itching we would treat with topical steroids, sometimes that you need an antihistamine to help with the itchiness. But that sounds like a pretty intense itching, so that an itching like that might even need like a short course of steroids, like a Pred pack or something, even if just a week of steroids. But that does sound like a pretty intense sort of deep itching. So it may not be that topicals or just over-the-counter antihistamines would knock that out. It might require a little bit of oral steroids.
Kristen, have you heard a patient describe their itching, that it feels like their bones itch?
I haven't heard that yet. I've certainly had patients who are so itchy that they break the skin just from scratching, but I have not heard kind of that deep sensation of itching. But yeah, we usually treat itching with a topical steroid, and then if it doesn't resolve, then possibly an oral steroid.
Thank you both so much. We actually made it through all of the questions that were asked, and that is all of the time we have for our program today. I want to thank both of the presenters and all of the participants for your enthusiasm and your questions that have made today's panel discussion such a great success. If you would like more information on resources on immunotherapy, please visit the Cancer Support Community's website. We would like to thank our wonderful panelists, Kristen and Ashley, for contributing their time and sharing this important information with us.
Thank you for having us.
Yeah, this was great.
It was fabulous. The cancer support community would also like to thank our program supporters, AstraZeneca and Merck. And participants, please take a moment to complete our post-webinar survey. You will be automatically redirected to this once I stop talking. If you take the time to fill out the survey, it provides us with great feedback so that we can make webinars even better in the future. Thank you all for your participation and have a great evening.